Okay, well, hello everyone, and welcome to our launch event today, where we're officially launching the Global Centre for Healthy Food Environments and the latest piece of research work that we've completed. This, as you know, is a webinar, so you should be able to see the slides in front of you, the four pictures of us. And you will not be able to speak or see anybody else that's attending, but you do have the option through the question and answer box to submit questions, which we'll be able to address later in the webinar. So I'm Thomas Kelley, the CEO of Sprink, and I just want to say a few very short remarks and to express my thanks, first of all, to my colleagues, Ed Maile, who leads our work at the Global Centre for Healthy Food Environments, and Matt Salt, a member of Ed's team, as well as our community of experts, which were a critical part of the research work that we've done, and also Veronica Graham, who will introduce more fully later, and Phil Shelley, who will join us in this afternoon's launch event, for being willing to give their perspectives, and indeed all of you for giving up your time to attend this event. And I hope that this represents the start of a relationship between us and you, as we collectively try to build the momentum around the creation of healthy food environments within healthcare systems. So thanks very much again, and I'll hand over to Ed. Ed.
Next slide, please, Matt. Fantastic. So thanks so much, Tom, for a wonderful introduction. Thank you so much, everybody attending, for taking time out of your days. I'm sure you're extremely busy to join us here for this launch event. This is a global event, and we're really excited to have people joining from places far afield as Abu Dhabi, North America, Singapore, Europe, Australia, Britain, and yeah, I hope that we can have a really fruitful event and discussion and take some of those global perspectives into account. Okay, so I'll go through the agenda for the event today. So as Tom mentioned, my name's Ed Maile, and I'm a senior consultant at Sprink and lead the Global Centre for Healthy Food Environments. That's half my time, and the other half of my time is as a GP, as a primary care physician in the NHS in England. And so I've had first-hand experience of food environments in healthcare settings, and that's part of what's kind of instilled my passion and interest in this area. So I'm going to start, and I'm going to introduce the Global Centre for Healthy Food Environments. I'm then going to hand over to my colleague Matt, who's going to launch our report. So this is our first research report defining a healthy food environment within a healthcare setting. And we think this is a really essential question to work out what the gold standard is for food environments within healthcare, and to give healthcare organizations a benchmark and a goal to aim at in terms of optimizing their food environments. We'll then have what looks to be a fantastic presentation from our guest speaker, Veronica Graham, who will be introduced more formally later, but I'd also just like to pass on my thanks to Veronica for joining us today. We'll then have a Q&A, which will be myself, Veronica and Matt. And as Tom mentioned, please do submit questions through the Q&A as the webinar is ongoing, and those can then be asked during the Q&A. And finally, I'll wrap things up by discussing next steps and future involvement, and hopefully how we can all work together to move this area forwards. Next slide, please, Matt. Okay, so I think actually most of the housekeeping has already been covered, but just to say that this event is being recorded, and so a link to a copy of the recording will be shared after the event, and so please do feel free to share it with friends or colleagues who may have been interested in attending but were unable to. And as Tom mentioned, as an attendee, you won't be able to, or you won't be seen or heard on the recording, so there shouldn't be any concerns around kind of anonymity, for example. In terms of the report, so everybody attending will be sent a copy of the report following the event. And again, we'd really encourage you to share this widely with anybody who might be interested. It'd be fantastic to stimulate debate and discussion and feedback around the report. And so, yeah, please do share. And then we've covered the Q&A. Next slide. Okay, so I'm going to introduce the Global Centre for Healthy Food Environments here at Sprink. Next slide. So first of all, who are we? So we've already been mostly introduced. You've heard from Tom, who's our Chief Executive. You're hearing from me. My name's Ed Maile, and Matt will speak later. So Matt's a Senior Project Manager at the Global Centre for Healthy Food Environments, and is joining us at an exceptionally early hour in Philadelphia on the East Coast of the US. So I'd like to say an extra special thanks to Matt for getting up at such an antisocial time. But yeah, he's going to give us a really good talk on the launch of the first research report. Next slide. Okay, so first I'll start just by saying a little bit about Sprink more broadly before we get into the detail on the Global Centre for Healthy Food Environments. So what is Sprink? So Sprink is an organisation with a strong social purpose, and we focus on trying to make progress in two areas of healthcare particularly. So the first area of healthcare is a concept called person-centred value-based healthcare. You can read more about this on our website, but very briefly, the aim of this is to help people to enjoy the health outcomes that matter to them at a particular point in their lives. The second area, which you're going to hear much more about today, is the Global Centre for Healthy Food Environments. And then the third area are our bespoke services. So bespoke services are around building long-term relationships with individual organisations to provide commissioned specific services with a focus on either person-centred value-based healthcare or healthy food environments. And so, for example, that might include strategic advisory work around addressing a particular challenge or opportunity an organisation has, or commissioned education work or commissioned research programmes. Next slide. Okay, so let's get on to talking about healthy food and food in healthcare settings. So firstly, what's the challenge with food environments in our healthcare systems? So I know that many of you will be intimately acquainted with this, but there is rapidly growing global interest amongst consumers, health professionals and governments in healthy, sustainable and ethical food. And why is this? Well, I think it's because we're increasingly recognising the role that the global food system plays in very large challenges that the world is facing globally. So firstly, from a healthcare perspective specifically, there are significant challenges in the rates of obesity and non-communicable disease, many of which are partly or significantly influenced by diet. Secondly, the world's obviously experiencing an ongoing climate emergency, and we've got a shared goal of trying to limit temperature rises to 1.5 degrees. We know that the global food system accounts for about 1/3 of greenhouse gas emissions, and is also the #1 cause of loss of biodiversity. And so there's a huge challenge and opportunity to make significant improvements in terms of limiting the environmental impacts of the food system. And thirdly, we've seen, particularly in the West, a significant increase in interest in plant-based diets over the last few years. And I think that's a reflection of the increasing awareness of animal welfare issues within the food system. But also there are significant worker welfare issues within the food system. So sadly, there are significant human rights abuses within the global food system. And so from all three of these points, we believe that reforming the global food system is key to making progress in these areas. And so against that significant context, there's therefore growing expectation that our healthcare systems, which many of the public look to as kind of exemplars and the gold standard in terms of healthy living, that they should lead the way in terms of providing healthy, sustainable and ethical food for their patients, staff and visitors. And I think this is even more resonant because many of our healthcare institutions are what we call anchor institutions. So these are organisations that have a large footprint in terms of employment in the local area. They contribute significantly to the local economy. They procure large amounts of food and supplies from the local economy and often further afield. and they employ large amounts of people. And so if these large healthcare institutions orientate themselves correctly in terms of the food that they provide, then there is the significant, or there's the opportunity for significant positive impact. Next slide, please, Matt. Okay, so having kind of set the scene, this brings me to our vision. So our vision is that healthy food environments within healthcare settings are underpinned by the latest evidence that enable and promote healthy, sustainable and ethical diets, with the food being tasty and affordable as determined by different sociocultural and socioeconomic groups across populations. And I just wanted to pick out a couple of points from this vision. So the first one is that we recognise that the discussion around food and diet is often a passionate discussion, and people, I think, understandably and rightly, often have strongly held views. And we think it's fantastic that people are passionate about it, but equally we want to try and take a step back from some of the emotion in the debate and make sure that we're proceeding in an evidence-based manner in the things that we do. The second point is around being socioculturally and socioeconomically relevant. We're conscious, certainly my experience in the UK often is that interventions around healthy eating focus on those in higher socioeconomic groups. So people with the time and the money, for example, to buy lots of fresh ingredients and cook a meal from scratch. But actually, we know that there's significantly widening health inequalities in many areas of the world. And so we want to make sure that interventions to improve food environments are accessible and appropriate for all socioeconomic groups. Next slide. Okay, so we've heard about the context, we've heard about our vision, but how are we going to achieve this in terms of making progress in this area? So on this slide, I'll talk through our activities at the Global Centre for Healthy Food Environments. So we have 4 areas of activity. So the first one being research. So Matt shortly is going to talk about our first research report, which is launching today. But more broadly, we have a goal to undertake high impact research, which develops the concept of healthy food environments in healthcare systems in more detail. And specifically also has a practical application in terms of helping us to understand how to implement them more effectively. Secondly, we've got to focus on education. So we're developing a virtual education program which aims to equip people attending with the skills and knowledge to implement healthy food environments within their organisation. So we're hoping to upskill a cohort of people attending our education program who can then hopefully make progress in terms of optimising the food environment where they work. Our third focus is implementation, so working directly with organisations to implement healthy food environments themselves. And the fourth focus is community, so building a community of organisations who are working together to implement healthy food environments. And the aim of, or the hope with the community, is that there will be shared learning, shared education, and mutual inspiration between the organisations. Next slide. And then we have a membership model. So, so this is how organisations can engage with us directly. So the aim of our membership model is that we create a community of organisations who are members of the Global Centre for Healthy Food Environments. And all of these organisations have a shared focus of supporting the development of healthy food environments within healthcare settings. So members are perhaps most likely to be a hospital, for example, but may also be universities or governments with a particular interest in health policy. And then the activities that members can undertake are focused on the 4 activity areas I described in the previous slide. So shaping and participating in our research, education, implementation, and community activities. Next slide. Okay, so that brings me to the end of an introduction to the Global Centre for Healthy Food Environments. And I'm now going to hand over to my colleague, Matt, who's going to take us through the launch of our first research report. Thank you, Matt.
Thanks very much, Ed. So when we established the Global Centre for Healthy Food Environments, as Ed mentioned, we'd experienced a lot of these, going into a hospital and being able to experience what the food is like, and knowing that it isn't always conducive to the health of patients and staff. We realized that there was clearly some work that we could do to help address those points. And so we created a research part of our organization. And through that, we identified three research priorities. So the first one is around exactly what is the definition of a healthy food environment within a healthcare setting. We'd done some brief sort of literature scanning and realized that that certainly seemed to be a gap in the literature. To ensure that we all have a common point to which we are going, we thought that would be the first logical place to start. In the future, we'll then look to see how we can look to implement those healthy food environments within a healthcare setting. And then after that, number 3 will be to look at how we can involve the food industry within the healthy food environments creation at a healthcare setting to make sure that it is a truly holistic offering that we're providing. So just a reminder, this is the question that we're launching today. What is the definition of a healthy food environment within a healthcare setting? So in terms of the methodology that we used, it was a 3-step process. So we convened a community of experts. This was a diverse group across 10 countries, 17 experts with a range of disciplines and sort of knowledge foundations. The next step was to identify whether there is actually a definition for a healthy food environment. And we did this via a rapid literature review. And finally, to gain consensus across this community of experts, we then completed a modified Delphi process, which was an iterative process to ensure that we had consensus across that group. So in a little bit more detail, you can see here the makeup of our group. And the expertise was very, very wide across potential stakeholders. So it included public health, academia, nutrition, health policy, food policy, behavioral science, and environmental science. When it came to the rapid literature review, or the rapid review, it was composed of 2 components. So the first was an academic literature review using PubMed. We identified synonyms for healthy food environments in healthcare, and then went through an iterative process where we extracted the papers, did a title review, an abstract review, and a full text review of those papers that were of relevance to our topic. Simultaneously, we recognize that a lot of the work that is done within this area isn't necessarily from an academic point of view. It may be policy or organizational material. So we did a grey literature review to identify this and snowballed those references from within those to identify additional papers as well. Once we'd completed those 2 sections, it was then a case of identifying whether there were any definitions and also the potential components of a definition. And in terms of the modified Delphi process, so this is a process that we use to ensure we have consensus across a group. So a threshold of votes was agreed upon, and it was then a 3-step process where in the first 2 rounds, we would provide the components that had been identified, and the community of experts would be given the opportunity to rank those components on a scale of 1 to 3, 1 being not relevant, 3 being essential to a healthy food environment. And in that final round, we used a binary yes/no vote to determine whether a component should be included or excluded. Within these rounds, we encouraged as much feedback as possible. So we gave the opportunity for the community to give that feedback. We could then share that anonymously. And obviously this helped us with such a diverse group with a range of views and backgrounds to make sure that we were including their specific feedback and comments such that people could make informed decisions. And then in terms of the results, so these were split into 3 categories. 37 components were found to be essential to a healthy food environment. And we've split them up into these 3 categories. So the first is food procurement. So that relates to the sourcing and purchasing of food and drink by a healthcare system. And with a lot of these, you'll notice that some of them seem very straightforward and obvious, but there were some that we thought were of particular interest. So in terms of the food procurement, things like the food safety practices which minimize the risk of zoonotic diseases. Obviously, we recognize that a lot of organizations will be having safe food preparation practices, for example, but with that focus on ensuring or minimizing the risk of zoonotic diseases seems highly important. The next step was the next part of the definition was around food composition. So this refers to the type and nutritional content of the food and drink that is provided within the healthcare system. And again, some of these will look very obvious: inclusion of foods, inclusion of and vegetables. But there are a few that were really striking. So one is deliciousness. Obviously, it helps to encourage people to eat healthily if the food that they're consuming that is healthy is also tasty and enjoyable to eat. Then to ensure sustainability, things like including seasonal produce or prioritizing seasonal produce, that seems like a way to move towards a more sustainable aspect, whilst also making sure that we are eating a wide variety of food. And then in terms of the environment, so this refers to the physical environment and the culture of the organization in which the food is provided. Again, many of these will be obvious, but a lot of the research that is out there does demonstrate that the environment in which the food is provided has a large impact on the choices we make when we eat. Another item that specifically caught our eye was around a designated space for breastfeeding. So this was one of the items that was actually suggested by a community of expert member. And we think this is a really good way to ensure that people feel welcome, and there are designated places to ensure healthiness. Food security is another one that is of great importance, especially as we look at sort of lower income areas in the world, to ensure that everyone should have access to healthy food, and that should be a given. That will also obviously help us to alleviate health inequity in some way as well. But obviously 37 components is a lot to take in, and so as a way to distill that, we have created this definition. So this is, it is a healthy food environment is one that within a healthcare setting provides a diverse range of accessible and delicious food and drink options, which benefit the health of the consumer. They have surrounding environments which encourage healthy eating and serve food produced in a way which is sustainable and ethical for the planet, humans, and animals. So with that, I would like to now introduce Veronica Graham. As Tom and Ed have already mentioned, Veronica was a community of expert member, and she's come to share some perspectives on how they've looked to implement healthy food environments within her own setting. Now, Veronica is a manager of health promotion and planning, and a qualified public health professional. She has extensive experience in leading state public health policies and initiatives via collaborative and vibrant partnerships with diverse sectors. She is currently seconded to the Western Public Health Unit from the Victorian Department of Health in Australia. So thanks for joining us, Veronica, and over to you.
Thank you, Matt. Hello, everyone. This evening, I would like to share with you some of the leading work that has been done by the Victorian Department of Health, the Public Health Division, to create healthy and sustainable food environments in our Victorian health services. I'd like to share with you a journey of a large-scale change and innovation. Next slide, please. Before we begin, I'd like to take a moment to pause and acknowledge the traditional owners of the land, Naarm, and pay my respect to elders past, present, and emerging. In particular, I wish to acknowledge the Aboriginal people and First Nations people as having enduring connection to land, to community, and to culture. And because of that, the world is much better today. Next slide, please. In the brief time we have, there are 4 main areas I will be covering. Firstly, a brief policy context from both the health and the environmental perspective. A quick look at 3 current food policies in play in our health services, a deeper dive into one, and the majority of this presentation will be about the 7 strategies for success and what we have done in the real world to make this change at scale. Next slide, please. So where am I? I am coming to you from Australia, from the state of Victoria, from the capital city of Melbourne. You can see the iconic Melbourne city there on your far top right. We have, in terms of health services, we have actually 81 public health services, which comprises of hospitals, aged care and community health, totaling over 500 sites. And just a little bit about Melbourne and Victoria. Not only do we have a beautiful city, we have a beautiful coastline. We have a very diverse culture and a vibrant culture of people, over 200 different cultures. And we also grow a lot of our own food right here in Victoria. Next slide, please. So why did we want to do or make a healthy and sustainable food environment? There are many reasons, and here are just some. Basically, the essence of good health for all of us, and certainly for staff and visitors, is about looking after our health and well-being for everyone, and that's important, and that proves how we function and how we perform at work and so on. Also, health services are often one of the largest employers in any community, and by default they are a role model and can promote good health in terms of what they do and provide. It's a leadership piece, and when we see change from a health service, it often gives the business community confidence that this is for real and this is a policy shift, that then there'll be a viable business to make more and more healthier food options available. And finally, this work has been based on a very long and deep engagement with the health services, lasting over 10 years. We first did our state survey back in 2010 with 25% of our health services. We repeated that in 2015. And then in 2020, we actually did 100% of our health services and surveyed and interacted and talked with them, achieving a 93% response rate, which is amazing. And it is on that basis that we're very confident in the next steps. Next slide, please, Ed. Okay, just very briefly, this is a busy slide, but basically up the top you can see we have 3 key documents that are what I would call our authorising policy environment. The one on the far left, called the Victorian Health and Wellbeing Plan, is a piece of legislation, and falling out of that, the government has to make a plan every 4 years. And within that, it actually talks about accelerating implementation of healthy food supply in public settings. And then on the far right, there's another piece of legislation called the Victorian Cancer Plan. And within that document, it specifies that 80% of our hospitals should have healthier catering and vending by 2022. On the far right, you can see nationally there were ministers getting together and saying this should be an important thing for health services to do. And of course, you will be aware of the World Health Organization has an actual action framework for actually doing and implementing public food procurement in health services. So that's the health perspective. And if we go to the next slide, please, Ed. This is from the environmental perspective. And in Victoria, we're quite lucky. I mean, this has been building over time. This doesn't just happen. So we have that Public Health and Wellbeing Plan again, which also pays attention to climate change and impact on health. We have another piece of legislation called the Climate Change Act, that one in the blue there. The third one you see there is a social procurement framework where all of government, when they spend money, they need to pay attention to environmental impact, social good, what is this doing to groups of people? And so that's a very important document. And we have some recycling, reducing plastics policies in train as well. So there is quite a lot there. And when we began this journey, there was none of these documents over 12 years ago. You can see we slowly build. Next slide, please, Ed. Very briefly, I said that we would talk about 3 policies. So we have a suite of policies. It's called Healthy Choices. It covers public facilities, as you see the 4 on the top. Next slide, please, Ed. Yeah. So the second one to talk about, no, go back, sorry, it's that round circle. Yes, thank you. That local food procurement policy, the one that's circled there in the red, that is currently in development. It's a very significant piece. And if you look to the far right, you'll see the Victorian government made a commitment publicly that all food available in our public hospitals and aged care settings would be fresh, healthy, and where possible, locally sourced from Victorian farmers and producers. That is a very significant piece, and that is in a build up now in terms of the policy options that will come out of that. And the third policy, next slide please, Ed, is the brand new Healthy Choices Policy Directive, which was announced just last year and launched, its detail was launched at the end of last year. And just to click on, Ed, you'll see another red circle come up. Yeah. So not only is it talking about healthy food in in-house cafes, but it also removes sugary drinks. And that is a big move when you think about over 500 services involved. Also from all sugary drinks from vending machines and so on. And you can see what we're doing to make it real is we're phasing the implementation, and as of September 2022 we had I think 99% reporting on the sugary drinks, which was amazing for the state. We're very proud of them. Next slide, please. So the main part tonight, there are 7 strategies that we're employing to make this happen. The first one, you can see in the centre there, has been something we've been doing and continue to do. It's continuous engagement with the sector. So we are in communication. It's a feedback loop, and that goes all the time. Next slide, please. The second thing we do, the government funded an agency to provide a healthy eating advisory service to health services wanting to make the change. This is a free service. It comes out of Nutrition Australia, which is a trusted organisation. You can see the web link there at the bottom, and you can actually log on yourself from anywhere in the world and see the services available freely. It's a terrific service because it tailors itself to the needs of the particular service and it meets them where they're at. So that means you can really get a good outcome there. Next slide, please, Ed. The third thing we do is we have a very good monitoring and reporting tool. We've developed something called Food Checker. It's a brand new, when I say brand new, it's a few years old, but we developed it in Victoria, and it allows organisations to easily log in, put their menu, put a product, put their vending machine supplies in, and it gives back a real-time report, and it assesses how healthy the contents are as versus the policy. And we've also introduced a progress tracker, so you can see the journey of each health service as they make the changes. So that has been a really important feature. Next slide, please, Ed. Fourth thing, this is a fascinating piece. This is behind the scenes, and it's taken a few years. But in Victoria, we have something called Health Share Victoria. It's a statutory body that basically is it's the procurer of things that hospitals need, things like electricity, equipment, supplies, and so on. And it also is the procurer for food. And Health Share Victoria organise the best price from, the certain grocery products and so on. So over the years, we've worked with this organisation to change the tender specifications so that Healthy Choices, the healthy specifications, are now integrated into the catering suppliers tender. So that is a game changer. And it means that then these products become available for health services to purchase. So that's been a really big win. The fifth, next slide, please, Ed, which is number 5. This is another behind the scenes thing, and this is, we call it, this is a real piece of innovation called the Food Distributors Initiative. And so anywhere where food is grown and manufactured, it happens in a factory or a farm, and it needs to get to the health service, the cafe. And there is an organisation in the middle called the Food Distributors, and they're the people, the trucks and the vans that go around and make that happen. So it's often a hidden sort of organisation. So we have proactively gone to those, to that organisation, there are many of them. We've targeted 11 across metro, regional and rural, and helped them classify their products against healthy choices. That's the first thing. And we didn't stop there. We actually are actively offering the staff training in healthy choices, so that when they are interacting with the health services, they can have a conversation, help guide what the selection could and should be. So that's another very exciting piece. Next slide, please, Ed. Leadership and support. We have a lot of health services really stepping out and doing awesome work. And I am going to call out the Western District Health Service and the CEO, Rowan Fitzgerald and John Headley. They have worked very hard ahead of the curve to remove sugary drinks, and they have turned their cafe into 100% healthy products. And not only that, they're very supportive of other health services that need help. So they'll take a phone call, they'll talk food service manager to food service manager, that practical guidance. They also are a leadership piece in terms of their interactions with their community and are supporting local cafes and so on to make healthy changes. And you can see, if you get onto our HEAS website, you can actually see that video where you'll hear Rowan talking about this himself and why he feels strongly about this. Next slide, thank you. And also in Victoria, we use something called collective impact. So when we are working with a system at a state level, we think about all the players that are interacting. And if one part of that system does something or produces something, we try and scale it out across the rest of the system. And that's great for everybody. It's efficient. You share best practice. So 2 examples here. So yet again, the Western District Health Service, they did produce commercially viable 150 100% green recipes, including, you know, cakes, all sorts of main course soups, so on, a whole menu. The department got, with their permission, of course, we were able to get those recipes, and we put them on the HEAS website, and we made them freely available to the entire state to use. They are in a commercial kitchen, they've got nutrient profiles, they've been costed, they've been tried, they've been tested. So these are really robust recipes. So when people say we don't know what to do, we say, here you go, start here. And the other thing we do is work, like that second example there, we have a Centre for Research Excellence in Food Retail. So they decided, and that's through the NHMRC, our big research organisation, and they decided to get behind this as well, and they used their capacity to further support hospitals trying to make the transition, and with the same messages. And then, of course, yes, continuous engagement. And that for us, there are 7, but there are the 7 strategies for success. And I really do thank you for, next slide, for joining me this evening. And I would like to acknowledge my colleagues in the Department of Health. We've got Zoe Wayner, the DepSec, Maria Bubnik, Exec Director, and the team, including Sharon Lawrence, Kelley Neville, Rita Alvaro, Sandra Marshall, all working together to make this happen. And I thank you.
That's great. Thank you, Veronica. And when I first came across what you were doing, and having worked in hospitals for many years and always struggling to get access to decent food, I think this is extremely inspiring in terms of what is possible. And of course, there are other good examples around the world, but it is by no means systematic. And I think if we can learn from what you're doing everywhere, and of course it needs to be translated to the local context, I think it would be tremendous for population health, but also for the well-being of staff. And we know that's such a problem at the moment for most health systems. So we're going to go to questions, and I would encourage you, we've got a few questions that have come through. We've got a few questions, of course, that we wanted to use anyway to help stimulate discussion. I would encourage you, if you've got thoughts, reflections, comments, please put them in this Q&A box. I'll keep an eye on that, and we'll spend hopefully the next 10 minutes or so on questions before we wrap up. So the first one, and actually this is something that my personal view has changed on this, but it is the extent to which we should enable choice. And choice meaning, should we have unhealthy options in the traditional sense of what we mean by unhealthy, as well as healthy options within our healthcare system, food choices, or should we be taking a view that everything we provide is so-called healthy? Veronica, do you mind if we come to you on that first, and then we'll see what Ed has to say?
Choice is important. I think these sort of services, healthcare services, when we remember the leadership piece and so on, I think by and large, the majority, it's best to be healthy, delicious and appealing with a small amount of other bits there on the side. So, but predominantly healthy choices, I think, is the way to go.
Ed?
The current setting now is overwhelming, not the healthiest choices. So it's about flipping that around so that there is a majority there for people, but a little bit of something, a small bit of, if you want a small bit of something as well to balance out a meal, because eating is about balance. It's not about exclusively, 100% sort of one sort of way. So
yeah,
that's what I think.
Yeah, thank you, Veronica. Ed, what's your perspective on this?
Thanks, Tom. I think this is a really interesting question, because going back to what I mentioned in the introduction to the centre around food often being quite an emotionally charged subject, I think we have to acknowledge that it's also quite a politically charged subject. And people often, their political views and their views around food and choice and access to certain types of food are often intersecting. So I think there's two perspectives you can take. I think from a purely public health perspective, I think it's clear that the only food available should be healthy food if our sole aim is to maximize the population's health. But from a kind of political philosophy perspective, I suppose the answer is much less clear, and there will be some people who say choice is very important and we shouldn't be dictated to by the powers that be, whereas there are other people that say actually consumers need to have some friendly guidance in terms of channeling their food preferences. I mean, I think I'd probably perhaps use one example to maybe illustrate my view, which is that if we go back to perhaps the 1980s, and you walked into a hospital, probably most hospitals in the world, then it would be very normal to see people smoking in the hospital, and perhaps even patients smoking on the wards. And now everybody, I'd imagine, is of the view that isn't the right thing to do in a hospital, and there's no debate or discussion around it. And so we don't have this discussion or concerns around freedom of choice when it comes to smoking in hospitals. And so I think it perhaps would be appropriate to draw a similar conclusion around food, that if there are food types which are very obviously clearly damaging to health, like very high sugar fizzy drinks, that those aren't appropriate in hospitals. I think the final point that I'd make also is that often the reason that people are reticent to have unhealthy foods removed is that those foods are perceived as being the tastiest and most appealing foods. But I think the the challenge that we've laid down with our definition is that healthy food should also be delicious. So we believe that it's entirely possible for food both to be extremely tasty and appealing and delicious, but also very healthy. And I think if we can achieve that, then hopefully that would remove a lot of the desire for tasty but unhealthy food.
Yeah, thank you, Ed. So we've got the question, Michelle Haby, this is, that you brought up twice here about low and middle income countries, where there is, of course, a growth, particularly in the middle income countries and increasingly the low income countries, the non-communicable disease is becoming a very significant problem. And how, in a way, translatable is what we've heard Veronica describe and what we're discussing to low and middle income country settings, and how can we support that transition? Veronica, do you have any initial perspectives on that?
In terms of the economics of this, this is about just setting a baseline of basic offering of food availability. So if you do things at scale in terms of in a health service, the cost, it doesn't mean healthy food isn't necessarily more expensive than, it doesn't have to be more expensive. You can make very healthy food that is very affordable. If you can make big curries and soups, and there's an enormous variety that can be produced very cost effectively. And there does seem to be a bit of misinformation about that. It depends on what your ingredients are. So I think it's very applicable, and applicable. And the more this becomes part of the normal system, just part of the system, you get economies of scale, right? And when I spoke about if this happens across a state at scale, it starts to give the business world greater assurance that this is where it's going, and you have a bigger market for supplying healthy food, because all the hospitals now will purchase whatever it is, this particular, curry or whatever it is that's being produced.
Yeah, no, I think it's a very important point, Veronica, actually, about the cost. And I'm in Sri Lanka at the moment and spend a lot of time there, so a lower middle income country. And it is always very striking to me that whether you're in a public hospital here or a private hospital, the food is very bad. And it's even worse, I think, in the private hospitals. And when you look at rich people in a country like this, usually politicians or people who've made money through business means, they're often very overweight. Whereas generally, if you look at poorer people, they're often less overweight. That dynamic is changing, but that's by and large the observation. And that's because of the influence of Western diet largely on the rich, which is generally less accessible to the poor. And so it is absolutely not necessary for these hospitals to adopt the way we have done things in traditional Western nations. There is a way to do that, as Veronica says, less expensively, more locally, and with a greater focus on health. Ed and Matt, from the method, or Matt maybe on the methodology side that we used for this definition, maybe you could just comment on the low and middle income country angle to that, and whether we had one. And Ed, after that, briefly, maybe you could say whether you see a role for the work of the centre in low and middle income countries. So Matt, first of all.
Yeah, absolutely. Thanks, Tom, and thanks, Michelle, for the question. From a methodological perspective, you saw the community of experts sort of makeup that we shared earlier. There were 10 countries, of which I believe 8 were considered high income, and 2 were considered middle-high income or upper middle income countries. And therefore, obviously, it's difficult for us to, from a scientific perspective, be able to say these results are generalizable to all settings. Obviously, there will be a degree of carryover, and a lot of these components will be relevant. I think I called out when I was talking earlier about the food security. So when we were doing the literature review, that item was coming up specifically in low income settings. And so that's why that was included. And so some aspects of the definition will be more relatable and others less so. I think the overall definition, so that synthesized distilled version, can very much be something that is generalizable, but may just need some degree of tailoring. And I don't know, Ed, if you have any thoughts on that.
Thanks, Matt. Yeah, and thanks to the question as well for raising the point. I think it's a really important one, and it's one that we're very much cognizant of. And you'll see when we release the report that we've been explicit that we believe that the work is most relevant to high and upper high income countries, and we've also been explicit that it's an area for further work in the future to think about how similar work may be made relevant for low and middle income countries. I mean, essentially, from our methodological perspective, it was a pragmatic decision due to constraints. So we wanted to do a high quality piece of work, and therefore we had to acknowledge that our resources in terms of as an organization wouldn't stretch to do an extremely detailed piece of work across all income levels of countries. And so we had to focus on where we have credibility and expertise, which from our perspectives is in upper and upper middle income countries. Having said that, Matt mentioned food insecurity in his answer, and I think it's also important to acknowledge that lots of the challenges in low and middle income countries are also present in high income countries. So there are staggering levels of, sadly, food insecurity and hunger, for example, in the US and increasingly in Britain. And so it's certainly possible to, and I would hope that healthcare systems will work to address those challenges in high income countries, and that those lessons will then be transferable to lower income countries as well.
Okay, well, I think that, thank you, Ed. Thanks, Veronica. Thank you, Matt. And I think that can draw the questions to a close. And of course, if you've got anything that comes up afterwards, I'll just note your point here, Michelle, about growing food in hospitals, and indeed there are some of the very good examples in Wales doing that. Swansea Bay Health Board, for instance, that is increasingly doing that. So I also, and I think collectively we do recognise that there is a move in this direction, and hopefully we can help further build that momentum. So we'll draw this to a close, and for the final 5 minutes, Ed, I know you're planning with some closing remarks, so over to you.
Thanks, Tom. Okay, thank you, Matt. So yeah, well, first of all, a huge thank you to everybody who's joined us. We're very, very grateful, and we hope that you found it informative and interesting webinar. I just want to share some next steps around how we can collectively, hopefully, move this area forward. So as I mentioned, we're going to share our research report following the webinar, and please do share this widely. So via Twitter, via LinkedIn, via WhatsApp, via whatever your social media channel of choice is. And we really welcome debate and discussion around this, and any feedback and thoughts you might have would be gratefully received. Secondly, we're planning to publish the findings in a peer-reviewed journal, so a formal academic journal that will take place over the next couple of months. And we will share a copy of the formal paper once it's published. Thirdly, we wanted to just telegraph our future, or our next research project, which is going to be exploring the practical implementation of healthy food environments within healthcare settings. So moving from the theory, being this first research report, to the practice. So how do we actually make this happen in the real world? Fourthly, our education program will be launching in spring 2023. And as I mentioned, this will aim to equip people with the skills and knowledge required to make improvements in the food environment in their healthcare setting. And we will share details of this once it's ready to launch. And again, if you're interested in finding out more or working with us on this, then please do get in touch. And finally, I mentioned membership of the Global Centre for Healthy Food Environments. If your organisation is interested in discussing membership options, so whether you're a hospital, but it doesn't just have to be a healthcare organisation, it could equally be a university or a government body or a private business. we would be delighted to hear from you. So again, please do get in touch. Next slide, please, Matt. And so this is the final slide, which just contains our contact details. So you can see our respective email addresses, website, and LinkedIn page. So all that remains is to say a huge thank you once again to everybody that's attended. A particular thank you to Veronica for her fantastic presentation, which still was brilliant despite the technical difficulties. And thanks to my colleagues for working with me to make all of this happen. Wherever you are in the world, have a great rest of your day, and we hope to hear from you soon. Bye-bye.